Hi, now that you have all completed taking the notes for U5N4 digestive system organs, you have now qualified to become professors or doctors of the digestive system. And in this particular part of this unit, you are going to use your knowledge of the digestive system and its organs to help diagnose a few patients who have come into your clinic and are struggling with something in their digestive system. So what is going to happen, and what you're seeing here on the screen in front of you, are 1, 2, 3, 4, 5, 6, 7, 8 different potential disorders that a patient of yours could have. And then you're going to see on the next page, you're going to see a bunch of patients. You're going to see Diana, Maria, Linda, Harold, George, Adam, and your task is to read these blurbs, okay? These notes, these patient exam notes, and use your knowledge of the digestive system itself and the new knowledge of these different types of disorders the digestive system a person could have, and you are going to diagnose them. So you're going to read through this stuff, and then you're going to use this graphic organizer. So in the packet that you're going to get, the graphic organizer will be part of the actual packet. So you're going to diagnose all 6 of the patients, and then you are going to use that information a little bit later to actually create a patient presentation slideshow that you would present. And I say that in quotes because you're not actually presenting it unless you really want to. Your patient, your diagnosis for this patient. So you have the patient's name, so you put in Linda or Harold or whatever, their age, the date of the exam. Now for you, the date of the exam is going to be the day that you're doing this activity. So it'll probably be March 13th, 2025, or maybe March 14th. Because you might be doing this on the following day, on the Friday, right? You would like to put the sex of the individual, male, female, if listed. If it's not listed, it's okay to put other. And then you're going to identify some symptoms. So after you've read through these patient profiles, right, you are going to look for symptoms. Remember, symptoms are things that the patient is complaining about or telling you about that doesn't feel right. So those are your symptoms. Sometimes in some of these, there's going to be other things that are not necessarily symptom related, but they might be information that might be helpful for you when you're creating your patient profiles. So you're like, for example, this guy just returned from Mexico. That might be important later, but it's not going to be important like as part of their symptoms. So you could put like maybe this person had visited Mexico. That would be a good example. Other exam observations. Not every patient is going to have other exam observations, though. Some patients are going to be very blunt with what's going on with them. So just be aware of that. Then you're going to put a diagnosis. So your diagnosis is something simple, is literally simple as, I believe this patient has anorexia. I believe this patient is suffering from gallstones. And then you're going to put that into this box here. And then this is the part where you're going to use your knowledge of the digestive system, and you are going to cite or list the parts of the digestive system that have been affected. So in this instance, if the patient was having, I don't know, let's just say, and this is not an option, they were suffering from norovirus, which is when you get really sick with a fever and you throw up all the time. You would say that maybe there's something going on with the stomach lining, or you would say something is going on with the intestines, something to that effect. Now, treatment down here, this is going to be really important, and you are going to end up doing some research on this. So treatment for you is going to be how you will advise that patient to deal with their disorder. So it might be as simple as taking a specific medication. It might be more complex, like having to undergo some type of treatment over time. Like maybe they have to get some type of an injection. I don't know. But you're going to have to do some research on the interwebs to go ahead and figure out how you're going to treat this person's disorder. Okay? Now, like with everything, if you have references for this, and if you're doing and if you've done some Googling and you found information about a treatment for the disorder that you've diagnosed this patient with, then you are going to have to provide your references, right? So I'd like to show you something. So like if I Google something like pancreatitis, right? And I Google like pancreatitis, and I get this, right? And I'm looking for, and I know we all do this. We all go to this thing right here. We look at it. We say diagnosis, treatment, pain management, intravenous fluids, antibiotics if there's an infection, and surgery may be necessary in severe cases. Well, here's the problem with this: is that this is not a website. This is AI, and so you have to like find good websites to help you with this task. So let's say that like if you're looking at this and you click this little linky poo here, the linky poo sends you over to this part right here where it's got this stuff here where it's the actual information, right? And to be honest with you, one of my favorite websites for helping students understand disorders with patients is this Cleveland Clinic. They do a fantastic job of like actually like giving you actual real information that's not like way over your heads, right? So like look at this. They give you an overview of the pancreatitis. They identify if there's different types, and they identify how common it is, and then they go back to like some symptoms and what does it feel like, and then it even goes so far as to like talk about like can you die from it, and then other things, and all these diagnosis and tests and management and treatment. All it's like this is a really solid website to help you. Like the Cleveland Clinic is a really solid website to help you with some of to help you. But if you go and click on some of these things, like I don't know, like this one here, the unusual cause for chronic pancreatitis in patients with Crohn's disease. I'm going to tell you what, this is coming from an actual journal of gastroenterologists. Gastroenterologists are specialist doctors who only work on things that have to do with the stomach and the stomach lining and basically the lower part of your digestive system. So this is like really technical stuff, and like it takes me a long time to like read through and process this, and I have to do some research to figure out what these things are saying. So like if you're getting sent to a journal, that might not be the best place for you to start. So places like Cleveland Clinic, top notch. If you scroll down here a little bit further, we see the Cleveland Clinic comes up. There's Medline, that's not a terrible one. The NIH up here, this is really good, but it's also pretty technical sometimes. Like there's a lot of stuff on here. It can get really, really complex, but the NIH is pretty good. Sometimes you get into pancreatitis in puppies, and nobody wants that because nobody wants to see their best friend suffer, right? So like that's what you're going to be doing. So when you get to this treatment part is going to be really crucial for how you are going to treat this patient, right? And that might include tests that you would do further, right? So like some of these up here are being like food allergy testing was positive for an allergy for gluten. Okay, well, would there be other tests that you might want to do if this patient was presenting and you were unsure? I don't know. You might want to include that in the treatment part. But I guess what I'm getting at here is references are really important. Okay, so you're going to have this graphic organizer for all 6 of your patients, and your task is to diagnose every single one of those patients. You're going to have the block to do this, especially if I'm not here. So it's you can work together in small teams if you want. As a matter of fact, I suggest that you do, because working together in small teams for this can be really helpful. And then the other thing that happens every year I do this activity is doctors come to me and they say, did I do this right? Did I get this right? Did I diagnose this right? And my answer is going to be, I don't know, because you're the doctor. And we all know that doctors are human, and doctors have the ability to make a mistake. And sometimes if you've ever gone to the doctor and they've told you had one thing, and then you had to go back another time and they told you had something else, that happens all the time. That's how medicine works, and that's how science works. Like for me, I went to a doctor once. They told me I had a sinus infection, like right here in this general area. Turned out I had a deviated septum, but they fixed it, sort of. You should see it. It's huge. But the point that I'm trying to make is that sometimes doctors are right and sometimes doctors are wrong. And I don't care actually if you're wrong in this process, as long as you've done good research to support your claims. That's the key here. Okay, so this is part one.
Leon Vaughn, please report to the office.
In part one, this is how you're going to be graded, right? So your graphic organizer is filled in with appropriate information from the patient case file. The disorder is cross-referenced with appropriate digestive system organs. Like that's the key. That's the key that gets you the proficient on this part. Okay, so that's your task for today. I hope that you find it a little bit fun. It's not meant to be complex or hard, but the task for you is to do the best that you can diagnosing these patients. Do the best you can, and we'll talk about it next week when I get back. Okay, bye.